Namaskar. Today we will study the conduction system in heart. Before that, let us see how the heart functions. Human heart consists of four chambers. The upper two chambers are called atria. It is divided into right atrium and left atrium. The lower two chambers are called ventricles, right ventricle and left ventricle. The right side deals with the deoxygenated blood and the left side deals with the oxygenated blood. And the right side is separated to the left side by the septum, and there are valves connecting your atrium and ventricle, then from ventricle to the pulmonary artery or aorta by semilunar valves. So atria and ventricle are connected by atrioventricular valves. The right side atrioventricular valve is tricuspid, and the left side atrioventricular valve is bicuspid. This is also called mitral valve. And the semilunar valve in the pulmonary artery as well as the semilunar valve in the aorta, that aortic valve, both are tricuspid valves. Now the blood, the deoxygenated blood through superior vena cava and inferior vena cava reaches the right atrium, and the pure blood or oxygenated blood through pulmonary vein from the lungs reaches the left atrium. And when the atrium contracts, it contracts for 0.1 second. When the atrium contracts, the atrioventricular valves open and the deoxygenated blood from right atrium reaches the right ventricle. The oxygenated blood from left atrium reaches the left ventricle. Now, when the ventricle contracts, and this contracts for 0.3 seconds, so when the ventricle contracts, the semilunar valves open and the deoxygenated blood from right ventricle goes through the pulmonary artery to the lungs for purification, and after purification again it enters the left atrium through pulmonary vein. And when the ventricle contracts, the oxygenated blood from the left ventricle through aorta goes to the general circulation and reaches different parts of the body. So initially there is contraction of the atria followed by the contraction of the ventricles, and then there is relaxation. So atrial contraction occurs for 0.1 second, ventricular contraction occurs for 0.3 second, and there is relaxation for 0.4 second, and total is 0.8 second. So one cardiac cycle is 0.8 second. And here if we see atrial contraction 0.1 second, so 0.7 second relaxation, ventricular contraction 0.3 second, and ventricular relaxation will be for 0.5 seconds. So one cardiac cycle is 0.8 second, and in 1 minute there are 60 seconds. So 60 by 0.8 that is 72. It is the heartbeat. So a heart beats 72 times in a minute, and the contraction is also known as systole, and the diastole is also known as relaxation. Now the contraction of heart, how it occurs, the impulse is generated in the sino-auricular node or SA node, and then that impulse passes through the atrium, reaches the atrioventricular node or AV node. Then from AV node it goes to the bundle of Fish. Then through the Purkinje fibers it passes throughout the ventricles. So in this way the impulse is conducted in the heart, and accordingly there is contraction of atrium followed by contraction of the ventricle. So initially there will be atrial contraction or atrial depolarization, then there will be ventricular depolarization, then relaxation is our repolarization. So we can use two terms, depolarization for contraction and repolarization for relaxation. So depolarization means a normal cell, the resting membrane potential is in minus, so minus 70 to minus 90 millivolt. So in myocardial fibers it is minus 90 millivolt. So that means there is a gap of 90 millivolt between the outside and the inside of a myocardial cell. And when we say depolation, that means this gap of 90 millivolt decreases towards 0, and when the repolation, again the resting membrane potential is recovered. So depolation, there is contraction, and repolation, there is relaxation. So if this electrical activity or the electrical current which is generated during this impulse conduction, we want to detect, then we can detect it at the surface of the body, and a recording of the electrical changes that accompany each cardiac cycle is called the electrocardiogram. So it has P wave, Q wave, R wave, S wave, and T wave, and QRS, it is called as QRS complex. So the atrial depolarization or atrial contraction is expressed as P wave. Ventricular depolarization or ventricular contraction is expressed as QRS complex, and ventricular repolarization is expressed as T wave. And why this QRS complex is there? Because within the ventricular depolarization there is hiding of the atrial repolarization. So because of that, this structure looks like this, and it looks like a complex QRS. It is called QRS complex. So this electrocardiogram, from it we can know several things, like heart rate. From the heart rate we can know the sinus node automaticity. From the PR interval we can know the AV nodal conduction time or atrial excitation to ventricular excitation time. Then PQ interval, from that we can know the time required for the impulse to travel through the atria, and the QRS complex tells us the conduction time in the ventricle, and QT interval tells us the ventricular action potential duration. So there can be abnormality in the ECG, and if there is larger P wave, then we can say this is enlarged atrium. Because of that, there is larger P wave. Why there is enlarged atrium? Because the blood backs up into the atrium, because there is narrowing of the mitral valve or mitral stenosis is there. That you can see here. So when the atrium contracts, these valves open and blood passes from the atrium to the ventricle, and when the ventricle contracts, these semilunar valves open, whereas these atrioventricular valves close, so that there cannot be backward flow. And when this mitral valve cannot function, so that will result in enlarged atrium and larger P wave. Then larger Q wave, that means the cardiac output, output is your heart rate into stroke volume, So when this Q wave is larger, then that means there is decreased cardiac output, and there is heart attack or myocardial infarction is there. And when there is larger R wave, we say enlarged ventricles, like this larger P wave enlarged atrium, larger R wave enlarged ventricles. When there is lengthening of the PQ interval, then we can say there may be rheumatic fever or coronary artery disease. When there is elevated ST segment above the baseline, so suppose this is the baseline, above the baseline there will be say T wave like this, okay. So above the baseline, or it can be below the baseline also, So if it is above the baseline, then we can say there might be acute myocardial infarction. And if the ST segment is depressed below the baseline, then the person may be suffering from coronary artery disease, and the heart muscle is receiving insufficient oxygen. Then T wave, if the T wave is flatter than the normal, then the person may be suffering from coronary artery disease, and if the T wave is elevated, then the person may be suffering from hyperkalemia. So this is all about the conduction system, the ECG, and the abnormality in ECG and their interpretation. Thank you.